here. One of the most controversial topics in cancer is if you can take hormones or not. And there's a lot of negativity around taking hormones, and I'm actually shocked how many men and women have never had their hormones checked. So just recently I've been talking more about how to check your hormones, and not only from a cancer front, but also from a human being lifestyle, how you're feeling front. So of course we know that there's certain cancers that are driven by hormones, mainly estrogen and progesterone. However, we need to look at the whole picture here of what is actually not only stimulating cancer's growth. Could it be coming from high DHEA levels, high inflammation, from insulin, and how that impacts all the cascades and all the downstream sex hormones. So if you are questioning if you want to get your hormones checked or not, then you want to just ask yourself, even if you don't have a hormonal type cancer, you want to see how else do hormones play a role in your own health. And so I hear this all the time as a female where, you know, certain times a month, or you just feel like there must be something wrong or my hormones must be out of whack. And so some of those symptoms are just feeling more irritable, more emotional, lacking motivation, or it could be on the other spectrum of just feeling extremely aggravated, agitated, more angry than usual. And usually that is because there is an imbalance with testosterone, estrogen, and progesterone. So progesterone is more of our calming hormone, and so if there's any issues with sleeping, anxiety, just feeling puffy, even migraines, a lot of that can be linked to progesterone in the system. And we want to measure certain times of the month as well to see are they within range. So it's not just through blood work, it's actually the most accurate way is to look through a urinary metabolite. So you're collecting your urine sample at a certain time in the month, but then also doing a 24-hour urine collection where we could see what your cortisol is, just say in the middle of the night when you keep waking up, or first thing in the morning versus when you should be tired at night right before bed. And so we want to gauge that from a 24-hour perspective, and then look at that clinically as well. Okay, what was going on in your life? Was there a lot more stress around that time? Did you just finish therapies? Are you on a medication? We want to interpret the results with exactly what you are going through. And so that is a urinary test that we do offer in the clinic in Ontario, but also for anyone in Canada and in the US. If you want to get your hormones checked, it is a 24-hour urine test kit collection. So we send you basically the package where you just urinate on these little litmus papers, and then we send that off to, or you would send that off to the lab, and then we get this full report. So we could see what your cortisol is over a 24-hour period, all of your sex hormones, and we never want to assume just because you have certain symptoms that, okay, you must be low in testosterone, or like you must be low in estrogen. We need to know where is the root cause coming from. So if it's like low DHEA, for example, then that is going to have a negative effect on how much progesterone you're able to produce, how much estrogen you're able to produce, and testosterone. So we, instead of saying like, okay, you need to take all of these bioidenticals and all of these hormones, we want to treat it from the root cause. And so if adrenals are out of whack, for example, or you're overly stressed, and then we look at your 24-hour cortisol curve and it's just like through the roof stress and you're just go, 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 and you're maybe on the verge of burnout, how on earth can your body be producing these sex hormones and helping you feel like a normal, healthy human being? And so that is step one, is getting your hormones checked. I strongly believe no one should ever be on bioidentical hormones or any type of creams or taking anything unless you've had these hormones checked, so that we can intervene exactly where in the pathway things may be off. The other important thing is if you are considering taking bioidenticals, not only getting yourself checked, but looking at your genetics. So there's certain genetic predispositions, like the CYP1B1, if you have any like COMT issues, or any genetic variations which affects how your body is metabolizing these hormones. This is a really important thing to assess as well. Especially, I have seen in clinical practice where women have said, you know, as soon as I started this estradiol or started this hormone cream, that's when a few months later they found the cancer. So it could speed up the rate at which cancer is proliferating and growing. And that's even not just bioidenticals. I'd say that would be the safest way to be taking hormones. But that's also in hormone replacement, like birth control, anytime you're putting hormones in the body. And even not the typical sources that we think. So even like endocrine disruptors from our lifestyle, like if you're getting exposure to estrogens from perfumes and plastics, and really doing a deep dive evaluation of where are you getting these excess hormones from, or like animal products. Like if you eat out a lot and you're eating food that maybe is induced, like of course restaurants are going to look at the big picture of, I want to buy the meats that are the largest and I can, get the biggest bang for my buck, but usually those are the meats that are full of hormones just to make the meats larger and be more economical for the restaurant. Anyways, and so we want to just make sure that we're mindful of that, of where you are getting hormones from your environment, testing where you are currently, and then working with a naturopath or an integrative doctor, someone who is very well versed in how to tie all those pieces together. So we could even look at blood work too. So getting an assessment of, is it a thyroid issue? Is your T3 and T4 off? Is your reverse T3 off? What does your insulin and glucose look like in labs? But then combining that with all of the sex hormones and cortisol. So we want to get the full picture, and then also taking account genetics too. So like I said, there's certain people who have genetic predispositions that make it really hard for your body to break these hormones down. So the last thing that you want to do is be applying all these creams and trying to get yourself balanced if you know genetically that your system would be the one that would be stimulating any abnormal growth. So not to say you shouldn't be taking bioidenticals, but you want to make sure you have all of your, the ducks in the row. You have all of your things in place, like helping with liver detoxing, helping make sure bowel and microbiome health is strong, and making sure that you're just doing the right steps, so you're not just looking at a symptom and applying a cream that you think is going to help you. And I have seen that a lot, where someone comes in like with a cancer diagnosis and they're taking testosterone, which is like a huge no. You don't ever want to be taking testosterone if you have cancer. Taking estradiol, which is the strongest form of estrogen, and taking even progesterone. Like that can all affect cancer, and we need to make sure that we're addressing root cause. The other thing that's really cool with the Dutch test, or the hormone test kit, that's a urine sample, is it can see how your body's breaking down estrogens as well. And so we can look at the different estrogen metabolites, because not all estrogen is bad from a cancering perspective. So there's 3 main estrogen metabolites, and the 2-hydroxy, like the one of the 3, the 2-hydroxy is the safest and most protective form of estrogen. So when you think of heart health and bone health and mood and all the amazing things when it comes to libido and just your emotions, like you want to have your estrogens at a certain level, male or female. So we're not here to say like, get rid of all estrogens in the body, but it's really looking at what those metabolites are and making sure that the more dangerous ones, so the 4 and the 16-hydroxy, are quite low. So that's what's nice about testing. You can see how your body is breaking this down and how your liver is metabolizing these estrogens, whether it's from your own body fat, from the foods you're eating, from just what is circulating from adrenals, ovaries. And so it's important to get that marker and see, okay, where is the baseline now? And then you can even implement a hormone protocol, a plan, and a month later, 2 or 3 months later, reassess where your hormones are at. Because there's no other way to know what's going on in your system unless you're actually doing this type of testing. So this is something that my clinic in Ontario is reaching out to anyone who is interested in doing this type of hormone test. If you want to DM me or message me privately and ask any questions about hormones, or if you have questions right now, you can post them. But yeah, definitely put in the comments when I repost this video. And I want to help you get your hormones in balance, because personally speaking, I know how much it can affect everything in your life, from relationships to work to your body, your image, your self-esteem, your ability to, like if testosterone is low, for example, you don't feel like doing anything. You don't feel like doing anything. Like to go to the gym, you just feel no motivation. You could even feel brain fog, so even like to complete a task feels exhausting. So I totally get the importance of knowing where you're at and how much it could drastically change your life. So if you are interested in getting this test, definitely reach out to me and I can help you with the next steps. Okay, thanks everyone for joining.